Hello, I'm Ellie Lindsay, based in the UK, and I'm going to discuss today insufficiency of time and communication. And does it create a wound? Globally, we are still having a major issue with lower limb and chronic leg laceration. And my question to you is it a product of an aging society or an indifferent society? And in 2016, at the World Union of Wound Healing Societies, I presented along with my colleagues a call for action to address wound management and the problem it causes. Also, I was privileged to be part of the all-party parliamentary group on venous leg ulcers, a silent crisis. And yet, we haven't really changed. It's still a global problem. And when we look at the challenges today, they're static. There's still people coming through the system, and we have a universal wound care, interdisciplinary teams. We see several different professionals, and the journey and the signposting is quite daunting. Whilst all of this is going on, as professionals, we are confronted with the enormous challenge of delivering the highest quality of person-centred care, while expectation is to improve efficiency. So all of us have challenges. But I'm going to speak from my own perspective of how I see the global challenge, because we have a major shift unfolding due to scientific and medical advances, and most importantly, the rapid population growth of the older person as well in society. And to highlight these problems, I wanted a message with the UK parliamentary groups and the House of Lords to be aware of this. And I sought Professor Sergio Giannini's advice on what is it in a global setting. And you can see I raised this with Parliament from an international experts in the field of lower limb lymphatic phlebology vascular care. So we're all in the same position, I feel, and this, I understand, this presentation is a debate, so I'm hoping it will stimulate a debate. Is it really as I'm saying it is? Because I feel that these conditions that people are experiencing are often neglected. They're not on the agenda of any government, and I'm certainly lobbying to try and make sure it is. But my other question is, where is health prevention, education? What are we doing about it so people know about their legs and when to get help early? Because I speak to vascular and phlebology specialists, and they all say by the time I see the person needing my care, it's so late. If only they had a referral earlier. So I think we've got to address this. Also, when we look at waiting rooms, I mean, in the UK, we are so post-COVID in desperate need of addressing so many issues that have been sadly not addressed. And in my website, I get so many people saying, my leg ulcer is awful and I've got to wait weeks to be seen. Yet in some areas, excellent service. So there's disparity in care depending on where you live, and I'm sure that's happening globally. But for me, there's a massive shortage of staff, experts in the field, and we've got those problems. Yet the older population have so many problems: comorbidity, socially disadvantaged, isolated, and again, lack of public health promotion support on this crisis we've got to address. And to address this, the all-party parliamentary group here in the UK launched a document, Saving Limbs, Saving Lives. And here we are in 2023, still with major amputation rates. And it is a challenge. to all of us. Because in England, every hour somebody over 50 has a minor foot amputation, and every 2 hours somebody loses a whole limb. This is unacceptable in this day and age. They're life-changing. They affect every aspect of their life and their families' lives, and the depression is major, and of course social isolation where people withdraw from society. So it's a challenging time for all of us addressing these problems. But for me, we need to explore the individual's perception of what they're experiencing, what life with a lower limb is really like, but not only for themselves, but also for their loved ones. We need to have a far, far deeper understanding of their health status. That includes the psychosocial needs as well. But if only we encourage them to become stakeholders in their care, we would learn so much more. We really would. But with time and work pressures and demands, it's far easier said than done. But the reality is, it's challenging, not only for us, but for the family and the loved one who is experiencing this. And you can see from this painting, I spoke to a young gentleman who said, gosh, that's just how my grandma sits when I go and visit her. Her hand and the expressions on her face are just so like that painting. And he really sees that as a hidden wound, because it really is emotionally distressing for him when he goes to see her. Do we really include the individual as a partner? Do we address all their needs? Emotional, mental, spiritual, social, financial? Do we see them making decisions? Do we treat them with dignity? These are all words that really mean so much to us as clinicians, and I'm sure we all try and strive to do it. But with the pressure of time, the shortage of staff, again, we can only try. And the government, now we're looking at the popularity of the patient and family centre healthcare increasing, and because we really have to address this. We're all going to become a patient, sadly, at some time of their lives. But how does one feel as a patient when you're signposted to A, B, or C? And do we acknowledge that they might feel helpless, not listened to, and powerless as they're facing a department, people they don't know, and they're navigated to complex and complicated. And it can be extremely stressful and frustrating, especially when you see so many people or you don't get continuity each time you go to visit. It really is a daunting environment, regardless of how educated you are or how stoic you are. And do we really listen and hear what patients say that are in our care? Because unlike a wound, a visual where we can see, we can deal with, we're now looking at the hidden wound. And I've got a wealth of experience from people that have expressed their concerns of how they really feel and not been involved or even included in the conversations that go on between the consultant and the nurse specialist. They feel distressed, extremely devalued, and quite often disrespected. And they feel defenceless. And yet, if we think about it, what is more productive than having an excellent relationship between the multidisciplinary and the multi-agency team? Because that is at the heart of why we're doing what we do in our professions. Sadly, this is a true story that was addressed at my parliamentary reception. Without an expert knowledge of healthcare, you can only trust the system and assume they are getting the right care. This is about a mother that the family are talking about. You can read it at your leisure, but you can see it all comes down to poor communication and how disjointed we are, that we're not liaising and working with other disciplines. Sadly, their mother went on to, she just gave up and passed away because she just felt she couldn't go on. So we need to take into account the importance of advocacy of families and the individual, and we need to be their advocate as well. So what on earth does it mean being at the centre of care, where you can see there's a lot of text here? But I think patient stories are very, very powerful. And I really believe that it dispels the practitioner dominant and the patient passive relationship, because we all revert so quickly to becoming the patient when confronted with an unknown. And as you can see in this compassionate communication cycle, we must really improve our skills. If we're not already doing it, then I ask, please consider the listening, the acknowledgement, and the information. We must demonstrate a deep and respectful ability to listen to those in our care. Hence, we must all work together. I have created a social, psychosocial leg club, which is people being treated away from a medical environment. But these are all the people that I work with, because I can't do it alone, but we all need each other. And information giving, we're all confronted with this lower limb crisis, but where is the public information? And at one time we used to have this wonderful strap line, knowledge is power. And it is, if you can only get people to really understand what's going on with their lower limb, if it's edematous, if it's vasculitis, or whatever, and get early referrals to the general practitioner here in the UK, and then referred on. So also capitalise on social media. It's very powerful. A lot of the older age groups now go on, seek advice. They have a lot of information, and they're going to be coming to you with expectations that we all have to address. But in conclusion, very relevant today is the postcode lottery, the disparity, which really raises some interesting questions about modern society and the way all of us are currently delivering care. And I really feel strongly about this statement. Unless we reshape care delivery, harness technology, and reduce variations in the quality and safety of the care we need, then the reality is the wide-ranging public's changing needs will go unmet. We have to work together, and you can see there's a photo of the Member of Parliament who very kindly hosted my reception to raise this massive problem globally, and our manifesto of care. And I urge each and every one of you to please go on our website and sign the manifesto, because we have to deal with this unmet need, and governments, we really do have a powerful voice if we can all work collectively. Consequently, we must consider again preventative health promotion education. That is why I'm so committed to the work of the WIN Foundation and Vein Week. I have a wonderful team who are also committed to it, because it's all about person-centred care, improving their lives and raising awareness. Thank you for listening.